the union provides the security. We have some managers out here who believe that you do better with less, right? We've got some out there that are also advocating. But if it wasn't for the local people to set forth and say, no, this is wrong today. This person shouldn't be working these many hours. Can't you see they're tired, right? It's not safe nursing. And that's where the union comes in, where we have to make sure that we're supportive enough that they're going to pick that phone up if something isn't right and saying, somebody was hurt today because of this reason, right? It's dangerous on some of those units and dangerous to everybody. And maybe that's part of the message that the public needs to know. It's not only just on that unit that you got to worry about the staff and that, but it's also those patients that are in danger. And there's been publicity of late about what's going on in the nursing homes. That's been going on for a while. That's nothing new. And they're down, you've got one nurse that's looking after 80 patients, right? And the other disciplines are trying to help. But my mother-in-law was a nurse in the 70s and 80s, and she had 70 patient load. So really, is this new? It isn't really. The part that's new is that more aggressive people, through frustration, through disease, through whatever, are getting in there. And there's not enough adequately trained. And that's the part, it's the training part, and I don't see that happening. Because there's no, you need good training, you need experience, right? Yeah, and we lost a decade of nurses in the early 90s. So if you're educated as to the contract, as to what the social issues are, that you have the capacity sometimes just to ask the question. That's all you need to do, to ask the question. And some people get intimidated, but then there's a local president or a union steward or somebody at the head of the committee to say, we'll support you here, and we'll be able to hopefully affect a change, at least get meetings, at least to address what's going on.